Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with the weekly podcast of the Common Sense MD. Last week, we talked about hormones, bioidentical hormones in women, and that are going through perimenopause or menopause. And of course, it's the end of October. October is Breast Cancer Awareness Month, and so it's very important. We've all been affected by it. And it brought up a lot of good questions because I got a lot of emails this week that said, we realize these bioidentical hormones are safe. They don't cause breast cancer. They don't cause heart disease. However, I've had breast cancer. What can I do for all these symptoms that I'm having? So I thought that was a great question because I've got a great answer to that. Something I've been doing for a few years that I really don't talk about enough. And I really think we need to bring perimenopause and menopause out of the shadows and give women help with this because it's very much needed. And especially women that have had breast cancer because they're scared, they're hesitant. Those patients really cannot take any form of estrogen or progesterone usually because most of them are estrogen, progesterone receptor sensitive. So they can't do it. So what do? The answer is testosterone. Testosterone pellets in women with breast cancer is just an unbelievable answer to a lot of their problems and their questions. Again, the safety and benefits of using bioidentical hormones through creams or pellets is really unquestioned now. So bioidentical HRT is really a no-brainer. So what about these women that have suffered from breast cancer in their lifetimes, or maybe even women that are just worried about getting it? Go to my last podcast if you're worried about that, because again, only 1 out of 10 women with breast cancer have any family history of it. And that's the main thing I see that women are afraid of. Their aunt had it. So there is a family history in about 10% of women that have it. But the main risk factors for breast cancer, again, are being a woman and being an older woman. Those are the two, by far, major risk factors of it. So these women need help because a lot of times, if they've had breast cancer, they're on an estrogen blocker like letrozole or tamoxifen. And what they do is really cut down, if you don't have any estrogen. One blocks the receptors, the other one just blocks the production of it. Letrozole probably has more cardiovascular adverse effects than tamoxifen, but tamoxifen, you see more blood clots. You have a lot more bone loss with the letrozole, and letrozole may be a bit more effective than tamoxifen, but we're getting into the woods there on that. But let's talk about some practical things that you can do, because we know that as you go into perimenopause or menopause, that it's not only the symptoms you're going to get of hot flashes, night sweats, mood disorders, sleep problems, pain, but you also got to worry about osteoporosis, brain protection, heart protection from the bioidentical hormone replacement. But the stunner that really nobody thinks about, especially doctors, or knows about, is testosterone therapy in pellet form. We use so many pellets in our practice. 4-to-1 in women over men. They love them. They always come back for more pellets. But it's the best way to do any kind of hormone replacement, in my opinion, is pellets, male or female. And whether it's estrogen or testosterone, pellets, I think, are the way to go because it takes about a minute or two to get them in, and they just slowly release the hormone over several months, and you don't have to worry about it so much. You don't get the ups and downs. But remember, testosterone, which to me is the most important hormone of all the hormones, sex hormones, I mean, it's the one that people come thank you for because it's the one that is the most effective. Now most women that don't have breast cancer, have no history of it themselves, need progesterone and the safe forms of estrogen. So some women just can't do it if they've had breast cancer, though. So what do you do? Um, the thing about it, the reason the testosterone pellets are the answer is that not only does it take the symptoms away of the menopause, like all the stuff we've just talked about, it's very protective, but it also helps prevent the recurrence of breast cancer in breast cancer patients. And it also prevents you from coming down with breast cancer. At least it gives you a lot lower chance of it if you have no breast cancer and take testosterone pellets. Like I said, I've been using this for years. There's a well-known surgeon named Dr. Rebecca Glazier. She's at Wright State University in Ohio, and she's been doing it for at least two decades. I learned about her from a meeting in Las Vegas many years ago. And the women I've put testosterone pellets in that have had breast cancer are very happy that we did it. They feel great on it. And you know, when you look at all the studies and find out that they're protected against recurrence of the breast cancer, it makes you want to use it even more. But anyway, she conducted an 8-year study of her patients that were treated with pellets, her breast cancer patients that she operated on. Most all of them felt much better from the menopausal symptom rating scale, and she's had no recurrences of their breast cancer, zero. And there's a lot of other studies that have shown that testosterone pellets reduce the occurrence of breast cancer in both women with a history of breast cancer and those with no history of breast cancer. A woman's body requires testosterone to maintain muscle mass, energy levels, cognitive function. It protects your bones. It protects your heart. As I've said before in last week's podcast, women have way more circulating testosterone than they do estrogen, 20 times more. Most doctors don't even realize this. And it also helps with hot flashes, night sweats, mood swings, low sex drive, problems sleeping, vaginal dryness, painful sex, urinary tract infections, incontinence, weight gain, dry skin. Now, I found over the years that low testosterone levels are often mistaken in these women for other conditions like depression, chronic fatigue, chronic pain. And most people don't even look at this. So in women with or without a history of breast cancer, testosterone pellets seem to be protective against breast cancer and offer so many benefits that it's almost a no-brainer to at least talk to somebody who knows what they're doing about this. The only side effect I've ever seen from testosterone in women is facial hair, and that's not real common. All you got to do is laser it off. We do that all the time. Rarely acne. I hardly ever see this. And the only type of breast cancer that I would not use testosterone pellets in is called triple negative breast cancer. This is a rare form of breast cancer that you have negative receptors for estrogen, progesterone, and something called HER2 negative. Then you don't want to do it because it requires other very aggressive treatments for this rare and more lethal type of breast cancer. So anyway, the safety of testosterone in women has been evaluated for the past 80 years. And it's been known for at least 70 years that testosterone is anti-proliferative to the breast tissue and inhibits the stimulatory effect that estrogen can have. Remember, when you reach that perimenopausal age, you have way more estrogen than progesterone. So you get an estrogen dominant syndrome and fibrocystic breast, uterine fibroids, too much estrogen related to testosterone. And what the testosterone does, it binds some of the sites up. So it really is very protective. A couple of recent studies showed that with testosterone pellets, one study showed a 38% reduction in breast cancer. The other one showed a 40% reduction of risk of coming down with breast cancer or recurrence if you've already had breast cancer. Dr. Glazier, a lot of oncologists and other breast cancer surgeons send her patients to put testosterone pellets in them, and they're very happy. So in my opinion, testosterone pellets, and when I use a testosterone pellet in a woman with breast cancer, I use a anastrozole, another estrogen, mild estrogen blocker without the side effects of the heavy-duty tamoxifen and letrozole. I usually use that in combination with the T-pellet. And I'll follow the levels just to make sure they're not aromatizing any of it to estradiol or any of the other forms of estrogens. So it's very helpful. Now, in women that just need testosterone, there's a couple things I do. I make sure they have I check them out completely. I always do a Cleveland Heart panel, and I usually use just plain testosterone pellets in these women. They do great, and they love it while keeping an eye on the estrogen levels. So it's very helpful in women with a history of breast cancer and those without breast cancer. And you're not going to hear this from your gynecologist or your oncologist. They just don't know about it. There's Big Pharma doesn't make these. They're plant-based bioidentical hormones. They're not synthetic. They have to be compounded by a licensed compounding pharmacy, and who the FDA doesn't appreciate, and Big Pharma is against, so you're not going to hear about it too much unless you go to an integrative functional medicine doctor who knows compounding pharmacists that are way ahead of the game. But do your own research on testosterone pellets and the effects and prevention of breast cancer. And so now you have a tool in your arsenal to treat a lot of these symptoms and protect everything from your brain to your bones to your muscles to your symptoms from menopause in testosterone pellets. I think it'll change both the quality of your life and probably the quantity of your life. Your health span is going to be a lot better. So in wrapping up Breast Cancer Awareness Month, think about this option for women that have had breast cancer in your family or your friends. Please tell them about testosterone pellets. Very helpful, very useful. And I hope this podcast has been useful. Thanks. I'll see you next week.